Hello, good afternoon, everyone, and welcome to this Fireside Chat. Today, we will be talking about a really important topic for the disability community, which is advocacy and system transformation. And to dive into this topic and to learn from real experience of transformation, today we have with us Dr. Kush Kanodia, who is a disability rights champion from the United Kingdom. And in the coming minutes, we will be learning from the different campaigns that he launched in that country. So thanks very much for being here with us today. And I would like to start the conversation by asking you, how did you start your journey in campaigning and systems change?
Thank you very much, Daniel. It's a great honor to be here at the UN and Zero Project. So I have a lived experience of disability since childhood. Originally, my career went into investment banking, and then I realized profit without purpose is meaningless. And I've really benefited from the power of sports. I was the last person to accept to be a torchbearer for London 2012 Paralympic Games. And then soon after, I joined a charity called Level Playing Field, and they had been in a 5-year campaign with the Premier League about making all Premier Leagues football clubs accessible for wheelchair users. So I'll give you an example, like my local football club is Chelsea. So we have a 40,000-seater stadium. And technically, all they needed was 1 or 2 wheelchair spaces, an accessible toilet, and an accessible entrance, and they met the Equality Act. But it wasn't proportionally representational to the number of wheelchair users in society. So we started a campaign. This was led by a lady called Joyce Cook. I joined midway. We're working with grassroots organizations, disabled supporters associations. We worked with media organizations to raise awareness. And then we were passing a bill in the House of Lords to create reasonable adjustments. And this was when the Premier League received $5 billion in TV rights, and they were complaining about, I think, making 20 million reasonable adjustments in the stadiums. And I ended up becoming friends with the director for the redevelopment of Chelsea Football Club, my local club, explaining him basically why we need to make sporting stadiums accessible for everybody, for disabled supporters. They planned to move to Wembley Stadium back in the day when they were owned by Roman Abramovich. And essentially, the 2 biggest offenders were Chelsea and Manchester United. And when Chelsea made reasonable adjustments, Manchester United soon followed. So I give the analogy, I was like a super sub coming up on halfway and then scoring a goal like in the Champions League final. But it was a David and Goliath battle, a small grassroots organization transforming the Premier League. And now I work with the sister organization, Accessible, and we are partners of UEFA and FIFA in regards to making their tournaments accessible for disabled people.
No, this experience, it's really amazing. First, for the grassroots component and how society and citizens can really trigger change. And then what you said, that other teams follow suit afterwards by setting the right example. I would like to move to another of your successful campaigns, which is NHS, the big healthcare provider in the public sector in the United Kingdom. And I would like you to tell me more about this campaign and why it was so important.
So I'm a child of the NHS. The NHS, I believe, is one of the largest health systems in the world. The founding principle of the NHS is accessible for all, free at the point of delivery. I was a governor at Chelsea Westminster Foundation Trust in the London Borough of Kensington and Chelsea. And essentially, they wanted to start charging for disabled parking. And initially, I thought they didn't know the evidence base. So I explained disability, one of the strongest predictors of poverty in society, only 1/3 of our tube stations being accessible, UN stating there's been a systematic violation of disabled people's rights. That didn't make any difference. One of our values as a trust was unfailingly kind. That didn't make a difference. As a patient governor, I'm elected by the patients. I got the whole of the council of governors to strongly oppose. They delayed their decision from 2018 to 2019. So when they announced it, I said, if you do this, I'll start a national campaign to abolish all disabled car parking charges in all NHS hospitals in England. And they just said, Kush, you're welcome to do what you want. Essentially, who challenges the NHS? I become an ambassador for Disability Rights UK, and in 2019, there's a health think tank in the UK called the King's Fund, and the Minister of Health and Social Care at that time, Matt Hancock, was doing his keynote speech. After the keynote speech, there was an opportunity for Q&A, so I jump up, give the evidence base, mention what's happening in Chelsea Westminster, and I ask the minister for his support. As ministers so often do and politicians, he ignored the question. At the same event, there was Simon Stevens. Simon Stevens was the CEO of NHS England, the so-called most powerful person in the NHS. I approached him, evidence-based Chelsea Westminster campaign. All Simon Stevens could do was he just laughed in my face for 5 minutes. How audacious, you think you can challenge the NHS? Who are you? The world works in mysterious ways. There were journalists in the audience from the Times and the Telegraph. They contact me on LinkedIn. I interview with the Times and the Telegraph. The following day, the Daily Mail contacts me. So on the Monday, we were published in the Times, the Daily Mail, the Telegraph. Then BBC London contacts us. We start working with lots of organizations, MPs from all the main political parties. And essentially, an early general election was called in 2019, and we get the campaign into the Tory manifesto, into the Labour manifesto, and I got agreement by Lib Dems. So we transformed over 200 NHS hospitals, abolishing all disabled car parking charges, supporting over 3 million blue badge holders, getting the UK government to allocate an additional £1 billion into this policy change. I received an honorary doctorate from Kent University 3 years ago, and they said it was the most significant and impactful change in the treatment of disabled people since the founding of the NHS.
Sometimes when discussing with colleagues at the European Disability Forum, we often say that a good campaign and good media coverage is sometimes more effective than a court case. And I think this proves how you manage to change something using this type of campaigning. That's really important. Another topic that I wanted to ask you about relates to one of the other campaigns that you successfully implemented, which is the ultra-low emission zones I think in London City. And this is important because it highlighted the tension between sometimes accessibility and disability rights and climate justice. So I would like you to tell us a bit more about this campaign and how you addressed this tension that sometimes some people see.
So at exactly the same time that we transformed the NHS in 2021, London introduced the ULEZ, the ultra-low emission zone. So it was essentially a £12.50 charge per day for more polluting cars. But this was implemented without adequate reasonable adjustments for disabled people. Only 1/3 of London's tube stations are step-free. So for a disabled person to access primary care, secondary care, social care, to go to visit the shops for supermarket, £12.50 per day. And it was essentially a clash between climate action and disability rights. And essentially London was saying, like, either we have accessible environments or we have, like, clean air. And the premise of the campaign was no, clean air is a human right, but so is accessible environments. Climate action has to go hand in hand with climate justice and social justice. Otherwise, all we'll do is disproportionately impact those that have been already the most impacted. If you look at the stats for COVID-19 in the UK, 60% of all COVID-19 deaths were disabled people, even though the Office of National Statistics estimates disabled people amount to 17% of the population. 17% of the population, 60% of the deaths. So we started another campaign with Inclusion London. We had a vote at the London Assembly. I lost the vote by 2. I had Labour and Lib Dem vote against. At that time, they had a strategic pact. Green Party and Tories supported. But essentially, we created reasonable adjustments again. We exempted all DWP, Department of Work and Pensions, disability benefits. It supported up to 320,000 disabled people in London. And we also increased grants for wheelchair-adapted vehicles from £2,000 to £5,000 to £10,000. Because the other thing they hadn't contemplated was it wasn't just the cost of buying a compliant car, it was also the cost of adapting the car for a disabled person's needs. I was having disabled people coming up to me and saying, Kush, for me to buy a compliant and adapted car, it can cost anything up to £50,000. And I honestly believe this is the first time significant. ULEZ was the world's first ultra-low emission zone, and it's the world's largest ultra-low emission zone. Eventually, it's going to, climate action, we're going to have to implement it in all cities. I believe this was the first time significant climate policy was adapted for disabled people in regards to reasonable adjustments. And I believe this is a model that can be implemented now across the world. Like afterwards, what happened in the UK, Birmingham and Bristol replicated the same disability discrimination from London, but they didn't implement the reasonable adjustments. So now I work with Transport for London on IDAG, the Independent Disability Advisory Group, in regards to providing confidential strategic advice and guidance for disability inclusion.
This is indeed a good example of why the disability community needs to get involved in climate change and climate-related discussions. I think that many people here, both physically and online, would like to be as successful as you've been in such campaigns. So I would like to ask you, what have you learned from all these years in campaigning?
So I think one of the main things that I find is systems, they value academic experience and they value work experience. And the most critical missing component is lived experience. But we need lived experience in the bodies of power that speak truth to power. I believe it's really important to focus on inner change before outer change, because we all have limiting beliefs. In the Q&A to the minister, I could feel like my heart pounding and thinking I'm kissing my career in the health system goodbye. But if I went into those limiting beliefs, I wouldn't have been able to speak truth to power. I think it's important that we build bridges with everyone, because the truth is we were published in very right-wing newspapers, and I worked with all the political parties because I was worried about a hung government. I don't know who's going to be elected. If I don't get the policy into all the manifestos, I risk not creating systems change. I think it's really important to embed the disability mantra, nothing about us without us, into all the work that we do. And if you see all the campaigns that I've done, the slogan of the Zero Project is a world with zero barriers, but it essentially is following the social model of disability, that the barriers and the inequality that we face is inaccessible environments and negative attitudes. And essentially, that's the premise of the campaign. And even the Equality Act, I find a lot of people do not understand the law. A lot of people think if I treat everyone equally, I treat everyone fairly. And actually, with disability, sometimes we need to treat people differently to treat them fairly. And then the power of faith and belief and letting go and emergence. And also, I like to talk about reframing. Like when I was young, I used to think of my disability as a curse. Like, why am I smaller? Why am I weaker? Why am I always in pain? But actually, my disability is a blessing. The disability has given me meaning and purpose in life. It's helped me transition from being an investment banker to being a social entrepreneur. If it wasn't for the disability, I wouldn't have led on all these systems changes. So to me, the disability has given me such a great purpose in life.
So we don't have much time left, but I would like to ask you one last question. And this question is about the future. So what would you like to see in the future when it comes to disability campaigning and leadership?
So we need proportional representation of disabled people. In the UK, we estimate disabled people amount to 25% of the population approximately. But if you look at national government, local government, regional government, public sector, we're nowhere near proportional representation. Our stories must be told in regards to role models to inspire the next generation of change makers. The truth is, none of these campaigns have really been told by the newspaper, even though in the midst of the campaign we are published in so many national newspapers. I think it's also important to understand that we will all experience disability in some shape or form in the future. 80% of disabilities are acquired. And essentially, having an inclusive and accessible system is the greatest free insurance policy we can give the next generation. And I think it's really important to also just maybe we can just end on this, that disabled people can make change, and we are transforming the most significant and powerful systems in the world. Thank you.
So thank you very much, Kush. It's been an honor to have this conversation with you. And yes, we'll see the next chat soon.